Joining me now is the U.S. Surgeon General, Dr. Vivek Murthy. Dr. Murthy, thank you so much for being with us. 103,000 hospitalizations as of this morning. How much higher do you think it will go, and when will it peak?
Well, John, it is troubling to see these numbers, to see how high the cases are going, to know that our hospitalizations have increased like this. And unfortunately, this is a consequence of an extraordinarily transmissible variant, the Omicron variant. But as troubling as this is, and as tough as the next few weeks may be, there is something important that we've been learning during this experience, and that is that our vaccines, especially when combined with our boosters, have remained extremely effective at keeping people out of the hospital and at saving their lives. It's why we've been encouraging people to get vaccinated and boosted. When I talk to doctors in the emergency room and my colleagues who are in hospitals around the country, they continue to emphasize that the people they are seeing who are hospitalized are primarily those who are not vaccinated. So remember, those vaccines work, those boosters are more important than ever before. And finally, this is another glimmer of hope here, which is as we look at the data from South Africa and the United Kingdom, we are seeing increasing signs that the severity to an individual of Omicron compared to prior variants may in fact be lower. We still at a population level, we're going to have a challenge because of so many people being infected, but we're also seeing a sharp rise and now a drop-off in those countries. Hopefully that will be our case as well.
When? When do you think that would drop off in the U.S.?
So that is difficult to predict. We've seen that the rise and to the peak has been a couple of weeks, or several weeks, I should say, in South Africa and the United Kingdom. But we're always cautious about predicting what we'll experience here in the United States. COVID has made many prediction wrong. What we can do, though, is focus on taking the mitigation measures and wearing our masks, which we know help reduce spread, getting vaccinated and boosted as soon as possible, and ensuring that, especially in settings like schools, we're using testing to help reduce risk to our
testing.
students.
The Surgeon General of Florida now suggests limiting tests to high-value subjects, to high-value testing. Don't test everyone necessarily. Test people who maybe are symptomatic or at greater risk. What do you think of that?
Well, I think we've actually studied testing a lot over recent months, and we know where it's useful. For example, take schools. We know that using testing, surveillance testing in schools can be a very important way to help reduce risk to our teachers and to our students. We know that test to stay is an important policy that can be used. When we're using or making decisions, I should say, policy decisions on where to use testing, it's important that these are driven by the evidence. We also know that people who are asymptomatic can also test positive. So limiting testing to just those who are symptomatic is not entirely consistent with the science that we've learned over the last several months.
Do you think testing is essential to keep schools open?
I think it's one of several layers that can help keep schools open. We've learned over the fall, in fact, where we were able to keep more than 95% of kids back in school in person, that layers work. And those layers include surveillance testing, but also universal masking, using the $10 billion that was provided in the American Rescue Plan to improve ventilation. And we know that getting our kids vaccinated makes a huge difference as well. That's why you talk to pediatricians around the country, the vast majority of kids who are being hospitalized right now, in fact, are those who are not vaccinated.
I know you have school-age children. Do you think there's this point, in Chicago, they're going to hold a vote today, the teachers are to basically, not go in and teach right now. Do you think there's a scientific justification to not have schools open at this point?
Well, John, look, I know that these are tough times for parents and for educators. As you mentioned, I'm a dad of two kids. One of them is old enough to be vaccinated. My son is 5, and he's now fully vaccinated. But my daughter is under 5, and she's not eligible yet for a vaccine. My wife and I are planning to send her to school because, our school has the appropriate layers of precaution. It's a public school in Washington, D.C., and we feel proud of what they're doing. But in the next few weeks, schools are going to have to make some challenging decisions here. We hope that they use these mitigation measures that we know work to keep our kids safe. But I recognize that in some cases, schools may have to make temporary emergency decisions if they have a large number of staff, for example, who are out sick, or if they feel they can't take these measures. But the goal is keep our kids in school. That is our top priority. We just need to do it safely. Our mitigation measures can help us do that.
So the CDC changed its guidance for an isolation period after you test positive from 10 days to 5 days. And there is no testing requirement to get out of it. You don't have to test negative to go back and join the workforce. Dr. Anthony Fauci said that it was being discussed to now add a testing requirement. What's the status of that?
Well, John, as you mentioned, that guidance on shortening the isolation period was one that the CDC issued last week. They have certainly received feedback and questions about the role of testing in shortening that quarantine period, and they're actually working right now on issuing a clarification on that. I would expect that any day now.
What kind of a clarification? What do you mean?
Well, they're going to speak to the role that testing can play in a situation like reducing isolation. What they're trying to do, it's important to say more broadly, is recognize and incorporate both the evolving science on Omicron and on prior variants in terms of how long somebody remains contagious with the critical need to maintain essential services. That means making sure that people can see a doctor if they're sick, that there is a fire person to show up if their house is on fire, and that means that we have to balance those. Those are all part of public safety. So that clarification, as I mentioned, will come out in the next couple of days.
Just what is the science, though, behind the decision not to initially require a negative test? Is there science that says a negative test doesn't matter?
Well, I believe that if you look at the science, and again, the CDC is going to comment on that science, so I don't want to speak for them, but we have seen that there is utility for antigen tests in a variety of situations. We recommended them to people before they get together in holiday gatherings. We've certainly seen many schools and businesses use them to screen people out. So I believe that there will be a role for antigen testing here to help reduce risk as well.
I'm got to let you go, but the record pediatric hospitalizations at this point. Part of this is just that this virus is everywhere at this point and more people are getting it. But is there something particularly that makes children more susceptible to Omicron?
It's a really good question, John, and it's one that we've been speaking not only internally about, but with our colleagues around the world to understand, is there something that they're seeing in their data that makes them worry in particular about children? I would say at this point, it is still not clear that kids are more susceptible to Omicron compared to adults. But we do know that in many parts of the world that kids have had a lower vaccination rate, which may be one of the operative elements here that's driving kids to not only get sick, but to have some kids end up in the hospital. It's why I think we have even more work to do here to get more children vaccinated. We've got more than 200 million people vaccinated, fully vaccinated in our country, millions who are boosted. But kids, had vaccines authorized later for them, because the studies took longer to do, and that was important to do thoroughly. But now we've got to really put our foot on the accelerator, get our kids who are 5 and above vaccinated. It's more critical than ever.
Dr. Vivek Murthy, thanks so much for being with us this morning. Appreciate it.